We're now joined by Amanda Missey, President and CEO of an organization called Bergen Volunteer Medical Initiative. Amanda, great to have you with us.
Thank you. Thanks for having me. It's great to be here.
Tell everyone what your organization is and why it matters so much.
Well, it matters a lot right now because we are a healthcare center that is providing free healthcare to low-income working Bergen County residents who don't have health insurance. So COVID has made it even more important that we be here than ever.
You know, what's really interesting to me is people hear Bergen County. I'm over in Essex County. People hear Bergen, they go, oh, it's a pretty wealthy county, you know. It's not that simple.
It is not. There are pockets of poverty in Bergen County, just like there are everywhere. They might be a little better hidden here than they are other places, but there are absolutely people who do not have the resources to get healthcare or food or any of the other things that many of us take for granted.
So let's talk about some of the folks on the team. It takes more than a village, in fact. 125 volunteers?
Actually, we have 150 volunteers. About half of them are clinical volunteers, so doctors, nurses, nurse practitioners. And then we have another 75 volunteers who they might be interpreting, doing clerical work, calling patients. So we've got a lot of volunteers.
With all the pressure on healthcare professionals dealing with COVID, we're taping this at the end of 2020, be seen in 2021. Everyone's fingers are crossed about the vaccine, but it doesn't make everything go away all at once. And these folks have been under pressure for so long. Why would so many volunteer in addition to their quote unquote regular job?
Why would they do it? Yeah, that's a good question. So many of our volunteers are retired, so they don't have to trudge into work every day and be, you know, just assaulted by COVID. But we do have a number of people who are working, and I think they come here because this is medicine like they've always wanted to practice it. Because the care is free, we're not billing anybody. We are not worried about insurance companies or, you know, submitting insurance paperwork. It is just one-on-one with the patients. They get to spend lots of time with them, and I think it's really fulfilling for them.
You know, we're a not-for-profit, you're a not-for-profit. Nonprofits across the state and the nation are struggling to try to keep our doors open, do what we're doing. And if we're not for the corporate and foundation community, I don't know how we would do what we do. Where does your support come from?
Well, we get a lot of support from individuals. This year, we have gotten lots of support from foundations, which is wonderful. You know, Horizon Foundation, the Berry Foundation, Valley Bank, like so many people have jumped in to help us, particularly when the pandemic started. We actually launched a telehealth program in early April. We'd never done it before. There was a lot that we had to do to get that going, and our foundation and corporate supporters just really stepped up and helped us.
And by the way, only because they support us as well. PSEG, is it the foundation there that's supportive?
Yes, it is the foundation at PSEG that supports us. We have just been, the New Jersey Pandemic Relief Fund came to our rescue this year.
I'm sorry for interrupting. The New Jersey Pandemic Relief Fund that the First Lady, Tammy Murphy, is leading. Take a look at our website, steveadubato.org. You'll see the graphic there. We've done several interviews with the First Lady about that initiative and why it's so important. So a big part of your job, as it is for me, is fundraising, right?
Yes, a very big part of my job is fundraising.
Are we in some sort of fraternity, sorority that it's not that you want to be in, we have to be in, because you've heard that expression, no money?
No mission. No mission. That's right. That's right.
It's not a cliche, it's true.
I have to say that that's actually one of the best parts of my job is talking to funders, you know, letting them know what their support can help us accomplish.
So it's so interesting. You know, not only don't you resent it, you appreciate being able to tell folks how dollars are being spent.
Absolutely. And we do such a good job with the money. I mean, every dollar that they invest here goes a really long way. It actually only costs about $1,000 a year to take care of one of our patients. So
explain that to us real quick. Got a few seconds left. How does that work? $1,000?
$1,000 pays for a patient to come here as often as they need to get whatever kind of medical care they need. And that's because we are volunteer supported. And, we don't have to pay a lot in salaries. So it's just a great way to invest money and get a big bang for your buck.
And Amanda, we've actually had your website up. So if people want to find out more and find out how they can be supportive and helpful, part of what we are doing is an ongoing series. It's been over a decade, simply called Making a Difference, tied to the Russell Berry initiative called the Making a Difference Awards. We're trying to make a difference by featuring not-for-profits. Frankly, we're making a difference. So Amanda Missey, President and CEO, Bergen Volunteer Medical Initiative. I want to thank you so much, not just for joining us, but for really helping a lot of people. Thank you.
Thank you very much for having me.
You got it. We'll be right back right after this.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Economic Development Authority, Valley Bank, the Turrell Fund, supporting Reimagine Childcare, PSC&G, the Russell Berry Foundation, the Robert Wood Johnson Foundation, Johnson & Johnson, and by Caldwell University. Promotional support provided by NJ.com and by bestofNJ.com.
In the fabric of America, they are the toughest threads. One of the first things they learned was the code that every service member lives by: leave no one behind. Now all of us need to live by it too, because some veterans are being left behind. 20 of them take their own lives every day. Learn how to be there for a veteran at BeThereForVeterans.com. Honor the code. Be there. Leave no one behind.